Dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul. Today we are going to do an evaluation of the patient who underwent a hair transplantation surgery in our clinic 2 years ago. This is a 35-year-old white man with the normal type 5 of the hair loss. What briefly normal type 5 of the hair loss means? First of all, it means the loss of the continuity of the front hairline, open area in the front side, some miniaturization in the hair loss in the mid-scalp, and hair loss and all miniaturization in the crown area. On average, for the normal type 5 of the hair loss, we may need the numbers varying something between 4,000 to 5,000 grafts. Of course, number of the grafts may vary from patient to patient, depending on the size of the open area, the density you want to acquire, expectation of the patient. But the key factor here is the capacity or the ability of the donor area to give a sufficient number of the grafts to meet the expectation of the patient. The plan for the surgery was the reconstruction of the front hairline. The patient asked to do the maximum coverage per single surgery. But here is the tricky point. Most of the time for the normal type 5 and above, we may require a second surgery. Of course, number of surgeries again varies on the size of the open area and the patient's donor capacity, but roughly normal type 5 and above, most of the time may require second surgery. We call them touch-up surgeries to give more density and coverage specifically to the mid-scalp or the crown areas. Okay, the patient, as we have told, with normal type 5, we did the reconstruction of the front hairline, some basic rules regarding the reconstruction or design of the front hairline. We always get stick to the plan to keep the hairline slightly conservative and simple, because the hairline is designed according to the age of the patient, the face anatomy, and what's the degree of the hair loss. Does the patient's hair loss is still active? And there are many variables, so it's not only the wish or desire of the patient, but it's the reality of the donor area, face anatomy, age, and other variables. So we went with the mega session with the 4,000 graft extraction from the donor area. Out of these 4,000 grafts, 3,100 of this number was implanted in the front side, around 400 was used in the mid-scalp, and around 500 grafts was used in the crown area. At the end of the surgery, with the patient, we talked once again about the possibility of the second surgery, specifically to add the density of the mid-scalp and the crown area. The lucky point about this patient was that, yes, it was normal type 5, but the hair loss pattern, or receding on the hair loss pattern, specifically in the mid-scalp and the crown area, was narrow. If the hair loss or the receding of the hair on the sides were more wider or more aggressive, we would definitely need a much higher number of the grafts, and the second surgery would become a must for the surgery. So here comes one more question we get from the patient asking, hey, is the second surgery a must? No, it's an aesthetic procedure at the end of the day, but for the full thickness coverage and the good coverage, the second surgeries for the advanced stage of the hair loss are mainly desired. Here on the pictures, you can see how the design of the hairline was performing. Yes, the hairline may look slightly straight from the front side, but it's not the straight line. Here is the point, is that we get this question very frequently from most of our patients. Okay, the head is an all geometric figure, and when we draw the hairline or the line across the projection or direction of the shape of the head, the lines fold over each other, creating a linear line. This is called the horizon phenomenon every once in a while. For example, you can see the same phenomenon during sunset when the sea and the sun come in the same line, creating a linear straight line, but it doesn't mean that the earth is flat and something like this. No, but when the patient looks down, you can see it's a curvy line coming to the sides. And we try to keep the corners slightly narrowed and the hairline slightly higher, so it gives us the chance to give the patient more coverage and the density. And here you can see the result of the patient. The patient is very happy. We were able to catch most of our desired results. The front hairline is very natural, with a slightly thinning or receding hairline, and with the higher density to the front mid part. The corners are sharp angled or with some acute angles, so it gives a more masculine or mature look to the hairline. So the main goals of the surgery: reconstruction of the front hairline, covering the front side with a high density, and adding up density to the mid-scalp and the crown area, were acquired. One of the tricky points about this surgery was that the patient actually came with his brother, so it was like a double surgery. One of the patient in one room and the other one in the other room. So in upcoming time, we'll be sharing the results of his brother as well, so stay tuned.